Welcome to our channel. In this video, we are going to talk about signs of a panic attack. So before starting, please like this video and subscribe to our channel for future updates. When you experience sudden, overpowering terror for no apparent reason, you may be having a panic attack. Physical symptoms such as a racing heart, breathing difficulty, and sweating may also be present. When you have recurrent, unexpected panic attacks, you have panic disorder. The majority of people have panic attacks once or twice in their lives. According to a study published in 2019, 2 to 4% of persons suffer from panic disorder. Panic disorder is defined as a continuous dread of panic attacks or their symptoms repeating for at least 1 month. Panic disorder's symptoms commonly occur in young adults between the ages of 20 and 24. If you've had 4 or more panic attacks, or if you're afraid of having another one following one, you might have panic disorder. Panic disorder symptoms can be overpowering and terrifying, but they can be managed and improved with treatment. The most crucial step in lowering symptoms and increasing your quality of life is to get therapy. What is a panic attack and how does it happen? A panic attack is a sudden surge of acute dread or discomfort that lasts only a few minutes and is accompanied by several psychological and physical symptoms. Rapid heart rate, sweating, shaking, shortness of breath, hot flashes, and lightheadedness are among the signs and symptoms, as is a sense of impending doom, chills, nausea, abdominal pain, chest discomfort, headache, and numbness or tingling. What's it like to have a panic attack? Panic attack are episodes of acute dread that strike without notice. An attack usually lasts between 5 and 20 minutes. Symptoms can linger for more than an hour in extreme circumstances. Everyone's experience is unique, and symptoms often differ. The following are some of the most common signs of a panic attack: palpitations or a rapid heart rate, dizziness or vertigo, shortness of breath that seems like you're suffocating, changes in your mental state such as derealization or sense of unreality, or depersonalization, shivering or trembling, being detached from oneself, tingling or numbness in your hands or feet. A panic attack's symptoms often appear for no apparent reason. The symptoms are usually out of proportion to the level of danger in your environment. Because these attacks are unpredictable, they can have a substantial impact on your daily life. What is the average duration of a panic attack? Although the length of a panic attack varies from person to person, panic attacks usually peak in 10 minutes or less, and then symptoms begin to fade. Panic episodes are rarely more than an hour long, with the majority lasting 20 to 30 minutes. Is it true that panic attacks are bad for your heart? People who suffer from panic attacks and panic disorder may be at a higher risk of heart attack and heart disease later in life. While the link between panic disorder and heart disease is still debated, the study indicated that people with panic disorder have a 36% higher risk of heart attack and a 47% higher risk of heart disease than people without panic disorder. If you have panic episodes, seek medical assistance for any chest pain symptoms to rule out any cardiac problems. Can a panic attack kill you? While panic attacks can produce a range of medical problems, and many individuals report feeling like they are going to die when they have one, panic attacks do not cause death. Causes of panic disorder and panic attacks. You may be at risk for panic attacks and panic disorder if you are prone to unpleasant feelings and worry. Sexual or physical abuse as a child, smoking or interpersonal stressors in the months leading up to the first panic attack are all risk factors. Furthermore, genetics is thought to play a role in panic disorder vulnerability, while the exact genes, gene products, or activities involved are unknown. Individuals who have a parent or parents who have been diagnosed with anxiety, depression, or bipolar disorder are thought to be more likely to develop panic disorder. 5 things you can do right now to stop a panic attack. When symptoms of a panic attack reach their zenith, it can feel as if the episode will never end. While you may believe there is nothing you can do but wait it out, there are several tactics you may do to lessen the severity of your symptoms and divert your attention away from them. 5. Have a strategy in place. The most important thing is to have a plan in place regardless of what it is. When you feel a panic attack coming on, think of your plan as your go-to set of instructions for yourself. One strategy is to get out of your current situation. Sit down and phone a friend or family member who can help you divert yourself from your symptoms and calm down. Then you can use the procedures that follow. 4. Deep breathing should be practiced. A typical sign of panic attacks is shortness of breath, which can make you feel frenzied and out of control. Recognize that your shortness of breath is a sign of a panic attack and that it will pass quickly. Then, for a total of 4 seconds, take a deep breath in, hold for a second, and then exhale for 4 seconds. Repeat this pattern until your breathing becomes more controlled and consistent. Not only can counting to 4 keep you from hyperventilating, but it will also help you to stop other symptoms in their tracks. 3. Techniques for muscle relaxation. It's natural to feel like you've lost control of your body during a panic attack, but muscle relaxation exercises can help you regain some of that power. For panic and anxiety disorders, progressive muscle relaxation, or PMR, is a simple yet effective therapy. Begin with clenching your fists and holding it there for a count of 10. When you reach number 10, let go of the clench and allow your hand to completely relax. Then, starting with your feet, work your way up to your entire body, clenching and releasing each muscle group: legs, glutes, belly, back, hands, arms, shoulders, neck, and face. 2. Recite a mantra. While repeating an encouraging, positive mantra to yourself during a panic attack may feel odd at first, it can function as a coping tool. Try repeating a simple phrase like, "This is only temporary," "I'm not going to die," or "I'll be fine." All I need to do now is take a few deep breaths. 1. Find an object to concentrate on. Choose an object that you can see in front of you and make a list of everything you observe about it, from its color and size to any patterns it may have, where you've seen others like it, and what something opposite to it would look like. You can do this in your brain or to yourself or a buddy by speaking your observations out loud. Treatment for panic attacks. Psychotherapy and medicine have both been shown to be useful in reducing the frequency and severity of panic episodes. Personal preference, medical history, and the intensity of your episodes will all influence your treatment options. Several studies have demonstrated that cognitive behavioral therapy, or CBT, a type of psychotherapy, is the most effective treatment for panic episodes and panic disorder. You will work with the therapist on relaxation training, cognitive restructuring, mindfulness, exposure treatment, and stress reduction during CBT. Many people who suffer from panic attacks see a reduction in their symptoms after a few weeks, and symptoms sometimes disappear completely after many months. As part of your treatment plan, your doctor may also recommend that you take a drug. These drugs can be particularly beneficial in the treatment of panic attacks, anxiety, and depression. How can you assist someone who is having a panic attack? It can be terrifying to witness a friend or loved one suffer from a panic attack. It can also be difficult to watch someone suffer while feeling powerless to help them. While you won't be able to stop your loved one from having a panic attack, there are things you can do and say to assist them to get through it. It is critical to be calm, patient, and understanding. Encourage your friend to take deep breaths in for 4 seconds and out for 4 seconds to help them wait out the panic attack. Stay with them and reassure them that this is simply a momentary attack and that they will overcome it. You can also tell them that they are free to leave their current surroundings if they feel more at ease elsewhere, and engage them in the lighthearted discussion. Encourage the person to get care from a mental health professional as soon as possible once the panic attack is over, and they have returned to a calm state if they haven't already. You may help them even more by assisting them in finding a licensed expert, researching coping techniques online, and looking for self-help literature that might be helpful. Help and support for panic attacks. If you've been having panic attacks or suspect you might have panic disorder, consult your doctor and a mental health expert for a diagnosis and treatment. Although panic attacks can feel exhausting and humiliating, it's vital to realize that you're not alone and that your mental health is nothing to be ashamed of. You can get advice and help from a variety of sources, both online and in the form of support groups. Is it possible to avoid it? Panic disorder is frequently a long-term problem that is difficult to overcome. Some persons who suffer from this condition do not respond well to treatment. Others may experience periods when they have no symptoms and periods when they have severe problems. The majority of patients with panic disorder will have some symptom reduction as a result of treatment. It's possible that panic disorder cannot be prevented. You can, however, attempt to alleviate your symptoms by just taking medications as advised and avoiding alcohol and stimulants. It's also beneficial to recognize if you're experiencing anxiety symptoms as a result of a traumatic life event. If something you've encountered or been exposed to is bothering you, talk to your primary care provider or a mental health expert about it. So that's it for today. What do you think of our video? Let us know your thoughts in the comments below. And if you enjoyed this video and would like to hear more from us, please subscribe to our channel and turn on notifications before you go. Thank you so much for watching us.